Welcome to the ClearTriage video training series. In this video, I'm going to provide you with an overview of how to use ClearTriage to complete a triage assessment, determine the appropriate disposition for the call, provide patient education, and document the encounter in your EMR. Note that on the home screen of ClearTriage, you have access to several different things to help you get started. The Notes field at the top of the screen is where you can enter your narrative note. This can include the caller's description of their symptoms and your initial assessment, and can be updated anytime throughout the call. On the right-hand side of the screen, you will see quick instructions for using ClearTriage plus links to helpful resources. Please take a moment to read this information and explore these resources. On the left-hand side of the screen, you'll notice a list of all of the protocols available in ClearTriage along with a search field that will assist you with protocol selection. As you listen to the patient or caregiver describe their health concerns or current illness, you'll want to determine the chief complaint or symptoms the patient is experiencing and search for that in the protocol search field. See the Finding the Most Appropriate Protocol Training video for a closer look at protocol selection. Now let's go through an example call together. For this example, let's say a parent is calling because their child has had a sore throat for a few days. They also report that the child has had a fever off and on for the last 2 days. When you search for sore throat, you can see several protocols to consider. This ClearTriage account contains both adult and pediatric protocols, though your account may only have one or the other. If you do have both sets of protocols, you can tell which is which by the blue A's and green P's next to the protocol titles in the list. To see only the pediatric protocols, you could type PEDS in the search field. Note that after selecting the pediatric sore throat protocol, notice that there is now protocol-specific information displayed on the right side of the screen. The Criteria tab includes indications of when it is appropriate to use the selected protocol along with other scenarios in which a different protocol might be more appropriate. The additional protocols to consider are linked, so you can quickly see those protocols by selecting the blue link text. The ability to easily move between protocols to review the selection criteria will assist you with selecting the most appropriate protocol for your triage. You should always review the information in the Criteria tab to ensure you are using the most appropriate protocol for the call. There are additional protocol-specific resources available within the other tabs in this section. Those resources include initial assessment questions for nurse awareness and training, detailed background information, quick first aid advice, and protocol references. We'll discuss these resources in detail in another training video, but it's important to know that they are available should you need them. Once you've determined that this is the protocol you are going to use for the triage, select the blue Next button at the bottom of the screen to advance to the next step of the triage, asking the triage questions. Before we continue with our example call, let's discuss the structure of the triage assessment questions. Notice that the triage questions are grouped by disposition and listed in descending acuity order. To ensure care is not delayed for patients experiencing urgent or emergent situations, make sure to rule out questions in the order in which they are presented, top to bottom. Once you receive and document a positive response to any question, as long as all triage questions in the higher acuity dispositions have been ruled out, the assessment portion of the triage call can stop, as you have determined the disposition for the call. You do not need to rule out the remaining lower acuity questions. You can move on to the next steps in the patient's plan of care. During the triage assessment, it is critical to understand that ruling out each question does not necessarily mean asking each question verbally. If you have ruled out the question through information gathered during your initial assessment, within another part of the conversation, or from the patient's chart, it has been ruled out. For example, if our caller mentions early in the call that the child's temperature has ranged from 100 to 102, we don't need to ask if the fever is greater than 105. So, for our example call with the child who's had a sore throat, you'll go through the triage checklist, ensuring you're ruling out each question before proceeding to the next. You've already ruled out breathing difficulty and cyanosis, and this does not sound like a life-threatening emergency to you. The parent denies that the child is having difficulty moving their neck. In addition, you have access to the patient's medical record and can see that they do not have any chronic illnesses or a weak immune system, so you do not need to ask this question directly. You rule out additional questions including drooling, difficulty opening the mouth, dehydration, severe throat pain, rash, discharge from the ear canal, and the first positive is that this is a sore throat with a fever and the patient has been experiencing this for over 48 hours. You'll check the box next to this question, indicating that the disposition for the call is see in office today or tomorrow. Note the disposition guidance text that appears below the positive question, designed to be a quick reference for you as the nurse, with help text for that specific disposition. You can select the down indicator to reveal additional guidance not shown in the short preview. Helpful tip: hover over the gray information icons off to the right-hand side of the triage questions to see additional information related to that question. Now that you have determined the appropriate disposition for this call, you can move on to discussing the plan of care with the patient or caller. Oftentimes, this includes providing care advice and education, especially if it's going to be a while before the patient is going to be seen or if they are going to be cared for at home. Navigate to the Plan tab by selecting the blue Next button in the bottom right corner again. This provides access to the education points for this call as well as the disposition guidance. To see the disposition guidance at any time, simply select the down arrow within the disposition header. When providing education to the caller, you should choose 3 or 4 sections of care advice that are most relevant for their specific situation, so as not to overwhelm them. You want them to be able to retain the information and teaching. In this case, you might choose to provide reassurance and education, plus talk to the parent about appropriate sore throat pain relief measures, fever medicine, and fluids and soft diet. You can select the blue header to expand each section to see specific pieces of care advice. As you provide education, select the checkbox to include that information in your documentation. Lastly, and most importantly for patient safety, you should always cover the reasons to call back. All pediatric protocols include medication dosages for select over-the-counter medications. In this example, you might need to provide the parent with the appropriate weight-based dose of ibuprofen or acetaminophen for pain relief. Once you know the formulation that the parent or caregiver has on hand and the patient's weight, you can provide the caller with the appropriate dosage. In this case, let's say they have the chewable 160 milligram tablets at home and the child weighs 55 pounds. Click the cell of the dosage provided to indicate this recommendation was given in your documentation. Next, you might choose to follow up on this teaching with a care advice handout. Select the handout or handouts you want to send by clicking on the appropriate checkboxes. You can review the handouts if needed prior to sending by clicking on the preview button. Note that some handouts are also available in Spanish. After obtaining consent from the caller, enter their email address or phone number in the field at the bottom of the screen and click Send to share your selected handouts by email or text. You'll see confirmation below once the handouts have been shared. Alternatively, you can also share a link to a handout in your secure messaging system or your patient portal by using the Copy Link button next to the handout. Lastly, when you've completed the call and are ready to document, simply click the green Copy button in the bottom right to copy the call note. You can then paste the call note into your EMR and save it there as you typically would. The call note will include your narrative note along with all other pertinent information from the triage. Please note, if your organization has chosen to integrate ClearTriage within your EMR or another call system, this button may be displayed as Finish Triage instead of Copy. In this case, your call notes will then be transferred to your EMR programmatically, meaning you will not need to manually paste your notes. Thanks for watching. This concludes the ClearTriage overview training video. Be sure to watch more of our training videos to explore all of ClearTriage's features and capabilities.